All right. Good morning. So, good morning, good afternoon. I guess whenever you listen to this, I am absolutely excited. So, it's been about 3 or 4 months since I fired up a podcast, had somebody on the show. So, last year I focused on a lot of business stuff. I also focused into mental wellness stuff, focused on getting into health stuff. This year, I'm excited to put together a series of health things. And so, what I want to do is I want to bring on Dr. Ryan Tomlins in regards to we're going to jam on some conversations. He's a functional medicine doctor. Is that the proper way to say it? Functional medicine doctor.
That's perfect. That's
Okay,
perfect.
functional
Yeah.
medicine doctor. And let me share with you a little bit of my personal experience with Ryan. So I am an absolute dork, and then I want somebody that fits the philosophy that I'm currently thinking like. So 5 years ago, I actually went through a process where I called 18 doctors to find out and their offices. So I either wanted to talk to the doctor or I wanted to talk to the office manager to find out what the philosophy of treatment was. Because for me and our family, our mentalities typically do not fit with inside the normal primary care physician thing. Not that there's anything wrong with that. That's just not my philosophy. Okay. And so through those years, I had somebody in Lawrence and they were great. And then I found somebody local. Like there was something that happened on Facebook. I saw Ryan at the gym, and I'm like, I got to get to know this guy. So we had a cup of coffee, and so I got to learn more about Ryan, what he was up to, how he was doing it, what his overall philosophy was, which was absolutely fantastic and mine. So I was super excited about that. So with that being said, I've done some tests, and we'll get into more of these tests later. But I will say this at the very beginning is I did a test with Ryan and he goes, you may have just taken first place. Maybe not his exact words, but those are the ones I heard. He's like, you're the best. Maybe not those exact words, but that's what I heard. He said, you may have just taken first place. And I'm like, that's great. He goes, no, not in this. And I'm
Not
like,
when you
okay.
want to win.
I'm like, what is it? He's like, dude, your lower is like your lower GI tract, your lower bacteria. And I just tell everybody it starts with a B. I can't even remember the name of it. I'm like, it's a bacteria. It starts with B, which means bad. And he's like, and I've told people this. I'm like, if there's like 12 markers on the page that he pulls up, like 10 of the markers are in the red. And that's how bad this bad B bacteria was inside my system. So it's been absolutely wonderful going through that process with you, going through a low FODMAP nutrition plan and diet in order to straighten that up and getting ready for phase 2 here soon. So with that in mind, a lot of this stuff maybe could have started with prevention, right? As opposed to reaction. So I want to, our first jump off point with Ryan is to go into what does it look like to be proactive in what we're doing instead of reactive what we're doing. So Ryan, let's just jam on that and maybe introduce yourself a little bit more.
Yeah. Yeah. Thanks a lot, Anthony. I'm super excited to be here. As you mentioned, Dr. Ryan Tomlins. So a little bit about me. My training background was family medicine. That's where I did my residency down south in South Carolina, Greenville, still one of my favorite towns ever. But that was really a way for me to get to sports medicine. And so I did a sports fellowship with Dr. Andrews in Alabama, which was an amazing experience. And then for 15 years did like non-surgical ortho, sports med, but always had a interest in this kind of functional or integrative, or there's a few terms that are kind of thrown around there a little bit, meshed together. But some of the background I had growing up, my dad was a chiropractor. Family had a pretty strong health conscious, so I was always around that kind of environment quite a bit and had some interest in how that kind of correlated to some of the things I was doing, asking those questions why. And that's kind of what really led to me leaving that traditional system and kind of starting my own business of this functional medicine. It was pretty close to COVID that, all the health craze, going on. And I remember at that point really diving into fasting for the first time. Got a couple books, researched, and got into that, and it kind of just took off from there and started self-teaching. And really a lot of the functional stuff is a lot of self-taught from a medical perspective. There's been quite a bit of expansion with certifications and those kind of things now, but it's nothing you unfortunately learn in med school. People ask all the time, or I ask them, how many nutritional classes do you think I had in med school? Get a variety answer. And really the answer is zero.
Mm.
None, which to me is unfortunate because nutrition is a foundation, a backbone of health, or at least it should be. And so it really, why do we do this in medicine? And a lot of times it's a very robotic answer, like, well, that's the way we've always done it, or that's just what we do. And well, why? Because that doesn't make any sense. And are people benefiting from that? Well, no, but that's what we do. Like, okay, well, let's change the narrative, like always challenging the normal, right? And that's where I have a lot of respect for some of the functional folks and even, current traditional is like, do you challenge what's normal? Otherwise it's hard to grow, from that perspective. So a few years ago, I decided to take that jump. And for me, it's really about the prevention that you mentioned. I don't think it's, too hard to find that the U.S. is dead last and these chronic diseases that we carry. Our system is set up for amazing things if you're acutely ill, if you fracture your hip, if you have, pneumonia that needs hospitalization, stroke, immediate heart attacks. Like our system is great. We fix people pretty quickly. We do it probably better than anybody. But what we don't do well is the preventative side of things. Trying to keep people from that heart attack, keep people from things. I always joke with my clients that when they go to other providers, that they always have increase exercise and eat better. It's like a template they put on the discharge summary.
Yeah.
But most of them have no idea what that means, from the lack of training and that's where relying on other specialists or collaborating. That's one of our core values at Summit is collaboration. One of the things I was able, to learn from Dr. Andrews is know your limitations. Like there's no way you can know everything. Like surround yourself with people that have more knowledge than you in that area that can benefit the patient or the client together. So that's one of the things we try to do from a nutritional standpoint. So we have nutritionists we work with. Like I would be a fool to say that I know more than her about some of those topics. I've certainly learned more. We try to tie those together, but I lean on her quite often. Like, hey, look at this test. You mentioned like the FODMAP thing. Like I had no idea what that was until a couple years ago. And so it's really about how do we create our habits and our foundation of health to be preventative, and that's what we try to work with our clients about. Like, is assess where are you at. You come because you're struggling with things, but that's not really that fixing that one thing doesn't fix the whole problem. We have to kind of dig back into where you created some of these bad habits, and we all have them, including myself.
Mm-hmm.
And really figuring out what those are and what your blind spots are, and then tailoring that program kind of individually to that person and give them those tools to help them succeed. And that's what is exciting about it is, it's the time with people as well. Like in the traditional medicine and as a patient or certainly as a provider, it's room to room to room to room. You got 5 minutes in there. You got 30 people on the schedule. If you spend more, then you're going to be behind, and you got people, rightfully so, asking like how much longer because their time's important too. But in this kind of setting, we get to, how long do we spend, on your initial visit? We block 2 hours, and we're usually there an hour and a half. In the follow-up visits, at least 30, 45 minutes to go into the details of the testing so they really understand what's going on to make those changes. So those are the things that I really love the most is the preventative stuff, the time, the foundation.
Right. So what you're talking about is the exact process that I went through. Like, so we did like a 15-minute call just to kind of find out where we were at. Then you and I met for coffee because I was like, I want to meet this guy face. But normally it's like a 15-minute call. Then they come in for like a base camp, right? And I think that was called base camp. So come in.
Yeah, we call it base camp. We try to tailor it off the summit or the whole hiking experience.
That's right. Summit Health, right? Base camp. Right. Mm-hmm. So come in for base camp, and that's where you get a lot of in-depth. I know that was very valuable to me. I know that when I was explaining it to Evie, as far as her coming to work with you as well, I'm like, I think you're going to really like this approach. It's different than what we're used to. It doesn't mean that anything's bad. It just means that it's different, right? And so we like
Absolutely.
that approach of kind of like a slowdown. And I'm like, Ryan explains everything. He's got these little flip charts in his office and he pulls things up on the TV and he's talking about these pathways and, these different things. So you feel like you become a partner in your health versus, I don't know, you're just a passenger seat. So does that make sense? Like, I feel like
Yeah.
you're both working together to solve issues as opposed to just sitting in the back seat and watching the driving being done. Right.
Absolutely. I can't tell you how many times people have come and like, that's never been explained to me. And sometimes I get off a little, squirrel here or there, and I get, excited about that kind of stuff. But it's really like going back to the understanding of why they're taking a medication or what this test or why they need some additional testing. Uh, there's so many folks that will take something that a provider recommends because they have trust in that person or they want to get better, but they don't necessarily know why they're taking it. And pretty soon they have 10 pills and I'll ask them like, well, why do you take this? Like, I don't know. Or is it helping? I'm not sure. So it's really having the awareness of your health, and the people that are committed and dive into that health and are proactive are the ones that tend to do really well and ask those questions.
Mm-hmm.
Of why they're doing things. So that's what I love when people come and they've done some research and they feel like they're asking too many questions or like burning, but it's like, no, I love this. This is good stuff. Like this is you researching and pushing that envelope to ask good questions.
Yeah.
And I learned from it as well.
Yeah. And something you said that I want to go back to is you said nutrition is the foundation of health.
Yep.
And what I hear from my end with Evie and I doing what we do as far as nutrition coaches, specifically to get results, is that people will say, well, eating good is expensive. Right.
Mm-hmm.
And so with me as an accountability coach, not just in nutrition and health, but like I've been consulting and business coaching for over 25 years. And so I'm a very kind of I don't know if you're familiar with like Jocko. I think his name's Jocko Williams. He's like a Navy SEAL type guy. He asks very direct questions. So that's my mental approach. So somebody tells me, they say, Anthony, it's very expensive to eat healthy. My response is, and I also am a recovering financial planner. My response is,
Mm-hmm.
that may be true. Let me see the last 90 days of your bank statements and see where you spend your money. And what I have found, no, nobody has ever shared that to me because they didn't have to. Because right when I ask the question, you see the deer in the headlight
No.
look that they don't, it's not that they know where they spent their money, it's that they don't know where they spent their money, but they do know that they ate out a lot. Right. So people will say it's too expensive. And I'll say, well, the average American right now is currently spending about $500 to $600 a month of eating out. So you're telling me that buying something with like an 80% markup is more expensive than buying grilled chicken, 90-10 meat, whatever. And I'm not going to get into all the crazy stuff that some people get into when they're like, well, you got to buy organic and this and this. I'm like, listen, I'm just trying to get the freaking French fry out of your fingers right now. That's what we're trying to do is
That's
establish
right.
habits. Right. And so, Ryan speaks like and him and I will get jamming on this stuff. And then I talk about it from my perspective, just like I just did. I'm like, don't give me those excuses. I don't know if Ryan ever gets into that with his people, but that's what I get into. I'm like, don't give me
Sometimes
those. Yeah. Because that's not true. It's you made it true because that's the story you want to believe, but it's not truth. Does that make sense?
yeah, absolutely. And there was a great saying that was always stayed with me is either pay the farmer now or the pharmacist later.
Woo.
Um,
Yes.
and so, yes, things like that do tend to be a little bit more expensive, but from an overall health perspective and testing you might need and medications you may need, if you don't make that a foundation, will catch up eventually. That's not even covering what you talked about with prioritization of the $7 Starbucks drink in the morning. And Mark Hyman talks about this all the time: is that food is medicine, food is foundational. And not too long ago, he had a podcast or a blog. He's like, in this group of people, he's like, hey, we have this new medicine that just came out that has been shown to lower heart disease and cancer risk and all those things. And he's like, how many of you would be interested in trying this? And of course, they'll raise their hand and they're like, well, what is it? He's like, it's called food, diet. And they all kind of like, oh, because there's all like, okay, this magic pill, right? This kind of philosophy. And,
Mm-hmm.
so it's kind of the thought and presentation of that. But when you really think about it or dig into issues with people, no matter what they may be coming for or struggling, most of it, comes back to these foundational kind of things from a diet and a sleep perspective and an activity and lifestyle. And you're absolutely right. Sometimes, in fact, most of the time, what I'm doing initially is the lower hanging fruit. What can I take away
Mm-hmm.
from the habits, the chips, the 7 cans of pop or soda, depending on which part of the country you're from,
Yeah.
that you're drinking a day, the late night eating, the things like that sometimes make more of a difference than something I can add
Right.
to the regimen. So that's 100% right. And, anytime you talk about habits and changing habits and habit loops and those things, those are tough things to change. I truly believe that like weight, dietary stuff is some of the, if not the hardest thing to do in life.
Yeah. It is addition. What you just described was addition by subtraction.
Yes, absolutely.
Right. And so the addition to life quality and life quantity can be had by subtracting bad habits.
100%.
Yeah.
And some of it's free, like fasting. Doesn't
Yeah.
cost you anything.
Like drinking water.
Drinking water, going outside for the early sunshine, like so, you can get into grounding stuff, like walking bare. Like these don't cost you a thing, so
Right.
that makes it a little harder on the argument of things are expensive.
Yeah.
So it's a perspective for sure, and
Yeah.
it's a mindset, just like anything else. But you kind of digging in and changing that. And sometimes you got to be a little more abrasive, a little more direct. And in all honesty, I try to kind of read the person a little bit.
Mhm.
Is this somebody who's more direct or somebody that's maybe a little more sensitive with things? And so I try to read that approach as best I
Yeah.
can anyway.
For sure. For sure. Yeah. You talk about, different, when people come in with you and you're asking about like you have to fill out a form just like anywhere else, and then has to list the different medications. And what I
Yeah,
find is, and I'm curious, and I'm sure you've said this, is that sometimes the medications we're on are actually hurting our bacteria in our stomach, which then are causing other issues that if we had everything stable in our gut, because I remember listening in a podcast a long time ago, like your gut is your second brain. And
mm-hmm.
so what I've seen is people on all kinds of medications, whether it's depressants, anxiety, and stuff like that, that are on medications or antipsychotics or anything else, Prilosec, just all these different things that get into your system. But they actually, what's funny is they could be causing the problem that you're feeling. So then you stack more things on top of it. So there's a gal that I know that was taking an antipsychotic, and it was giving her no, an antidepressant, and it was causing her not to sleep. So then they gave her another medication that caused suicidal ideation. Then they gave her another medication that prevented the suicidal ideation, but the side effect was depression. So like it was like this loop. And not
Yeah.
to mention, like, what are those doing inside of our digestive tract? Because what if, not saying, I'm not a doctor, but what if that we were able to, under the right guidance and care, not just quick fixes, but remove each one of those from the human body, from the system, and allow the food to start fixing the body? Let food be the medicine. Let sleep be the medicine. Let our meditation and our prayer be the medicine in our body. And then go
Yeah.
from there.
Yeah, and that's hard for some people to really do because we've kind of just come as a society to a lot of bad habits and going back to those foundational things. But you're absolutely right about the second brain and the gut. It's really our only access to the outside world. Mouth to anus kind of stuff, and all of our immunity is in there, and it talks to our brain, and everything we do daily is affecting that gut, or this term microbiome. And I think more people are becoming aware of that and may not know what it means, or
Mhm.
how the things they're doing is affecting that. But this thing is a constant, it's a living environment that's
Hmm.
changing hour by hour, day by day. And everything you're eating, drinking, activity wise, sleep, they're all affect how your gut is managed in that aspect of things. And so where we can help people in the habits, but is also the awareness of the availability of some of these things that we can evaluate where you're at, the testing that they may have no idea is even available to see and help. And you mentioned like the medication thing, like we see that a lot in the mental health industry or world. And that's kind of how most of us are trained for the most part, is a little bit of shoot from the hip on the meds, like, hey, try this one. Like, there is some initial thought behind some of the other medications that might help boost things up a little bit or lower. But for example, like one of our tests we do is called Clarity X, which is a genetic test for medications. And so it's just a spit test, and it gives you almost 300 medications from antidepressants to over the counter meds like Tylenol and NSAIDs to blood pressure meds. But based off of your genetics, it gives you categories: green, yellow, and red,
Hmm.
how you metabolize them, how you handle that medication to have good options. So that person you mentioned may have taken two, three drugs in the red, not knowing. Whereas if they had that, we can pick one from the green. They're much more likely to tolerate it better. Now, it may not fix all their problems because, as they say, people that are, depressed. Well, they don't necessarily have a Lexapro deficiency. You're not low in Lexapro, or
Right.
there's some debate about, is serotonin really the cause or the only cause of depression. It's probably multifactorial, like almost everything in medicine.
Right.
But it's kind of that, hey, write that pill and now everything's right with the world. Like, and some people will come in. I mean, there's some people that are just really depressed and they have fatigue, and they've tried these medications, and like no one's ever asked them about their diet or dug
Right.
into their sleep or their sleep patterns or behavior or their gut health or activity or anything like that, to try to tidy up some of those things that may be lacking. Because unfortunately, our answer in traditional medicine is, hey, just take this pill for the rest of your life and everything will be fine.
Right.
And so
Yeah.
that's where we try to be different, is like, hey, there's much more to it than that. And then we never ask the question, is like, hey, can we get people off of these things, right? Why
That's
does this
right.
have to be on medications forever, whether it be for cholesterol or blood pressure? Like, we never do that. It's just, oh, your numbers look good, keep taking your meds. So,
Right.
I try to eliminate meds as much as we can, or taper off. Some things are maybe not that way, but we're gonna at least try.
Right. So the idea is to have a true north idea. So there is ideal world where we have an ideal body and an ideal functioning body and mind. So we have this ideal. It doesn't mean that we're going to arrive at perfection. It just means that we want to get as close as we can to that ideal perfection. Does that make sense?
Yeah, yeah.
That's the model is, how do we make it perfect knowing that it's not going to be perfect?
Not
Right.
gonna be perfect. That's right.
It's not going to
That's
be perfect,
exactly
but
right.
that's our model. Because if you have something that you say, well, let's aim for less than perfect. Let's aim for, so instead of aiming for 100%, then let's say if you aim for 100%, but you land at 70%, but if your aim is 50%, you land at 30%. Does that make sense? So if our
Yeah,
model is our if our standard is low, then our actions and our behaviors and the way we live life is low. Does that make sense?
yeah. I think, and you probably know a lot more about this from the coaching. And like, if that's not your goal, to have those kind of things, or to be perfect, as you say, knowing that it's not going to be, then it's hard to get there. You start to get complacent once you do get to that, and like, now what? And if you're not willing to shift and change a little bit, that can cause people to struggle. And so that's what we'll get into, a lot of goal setting and numbers. And numbers are nice in medicine, but really, how you're feeling is important too. So trying to bring those together, but also, like, it's a constant, um, tweaking of things and reevaluation and improvement in that, and just not being satisfied with where you're at, because our time on this earth is so short.
Yes.
I don't know if you ever seen that life calendar. I think maybe I saw it initially with like Peter Attia, or he had posted a picture with it, but it's like a life in weeks. It's this big poster, and shade in or cross out the weeks that you've lived. And like, for you and I, we're about the same age. Like,
Mhm.
look up there, and the calendar is, or the poster is half full, or maybe a little bit more. It's based off like the average age, which is like upper 70s for most
Right,
people.
right.
Like 2/3 of my average, his life might be over.
Yeah.
It's pretty eye opening just to look at. Um, but it's just like, what am I going to prioritize? What's important to me? Living longer, being around for my kids, spending time with the family, like being healthy. As they say, what good is wealth without health?
Yeah.
Kind of thing. So it's just a mindset, just an overall, how we want people to prioritize that, and make it a something it has to be important to them.
Yeah, absolutely. And going back to the gut stuff, is my gut indicator, and I can't remember. Do you remember what the B was? Like my bacteria? Was it B? It could have been. But you said,
I don't
I
remember off
know,
the top
I
of
know
my
what
head.
you.
I remember most of them being positive.
Yeah, I know that you said
or
that
all
you thought it was going to be something like called candida, but it ended up being this other thing. And I was just talking to another buddy of mine, and he's like, "Dude, I got candida. Like, I got it. Like, I can't eat anything." And I'm like, "Sure, you can. You can eat ice. You can drink water." And he's like, "Oh my gosh!" But it's crazy because as he was talking with the nutrition person about like the effects of when you have a lot of candida in your gut biome, like these are some of the impacts of some things that you drink or eat. So like he's likes different kinds of whiskey or maybe a beer or something like that. So he wasn't associating that if he drank a certain type of beer or a certain type of alcohol, that it would immediately
mm-hmm.
give him like a reaction like a sinus migraine.
Mm-hmm.
And he didn't realize.
Yeah.
And that's so like when people are experiencing migraines, experiencing headaches, or experiencing fatigue, this goes back to maybe your gut biome is not where it needs to be. So when you're eating the current diet you're eating, or you have a lot of bacteria in there, it's actually making you feel these things.
Absolutely. Like, the first two things I think about when somebody says migraine is gut health and food sensitivity
Mm-hmm.
testing. Uh, in the things we do, kind of focus on direct up here, and through the years, I can't tell you how many scans we had ordered, CTs, MRIs. 99% of them are normal for migraines, because I think we know that it's kind of more of a neurotransmitter or a functional
Mm-hmm.
kind of issue. But we tend to, give them medications to, treat them when they're acute, which people are miserable. I mean, I'm sure we've all seen people with migraines. They're nauseous. They can't. Lights are bright. They don't want to leave. It's just a
Mm-hmm.
terrible, terrible thing. But taking that med when it happens, it goes back to the preventative things, like what's driving this functional issue that you're having these headaches from. And so we start to dive into those two things initially first. There's some other things we look at lab wise too, of course, but
Right.
it's that awareness. Some people just don't know the stuff that they're eating or their gut health is contributing to that. Like, in skin would be another great example. People come with these rashes like the eczema, or any kind of rash or acne, and a lot of times that has a gut origin to it. So fixing a leaky gut, or overgrowth of bacteria, or candida, or lower stomach acid, or food sensitive, or whatever the case may be, helps their skin. And it's hard to kind of wrap your mind around that initially, because we put creams to help with that, and those things help to the symptoms you're exhibiting, to lower the inflammation, but doesn't solve the overall problem. So
Mm-hmm.
that's what we're ultimately trying to get to.
Yeah. So testing. So like when I went in there for the testing, I did like a full set of labs. I
Mm-hmm.
did like an NAD test. I did a gut biome test. What was the fourth one? I did like four tests. Oh, food sensitivity test.
Food synthesis. Yeah,
Yep, yep, yep. So when I did the gut biome test is when Ryan's talking about a lot of the things he's talking about right now, like these are findings from the gut biome test, right? That was important
yeah.
that I did because there were symptoms that I was having and I could not fix them on my own. No matter I am captain of chat GPT and watching freaking YouTube videos. And I was trying for a year, I was trying all kinds of different things because I didn't know it was like a gut issue. I'm just trying to find different ways to get my gut to react better. And it didn't do it. So it was a blessing to have bigger conversations with Ryan in regards to that. But that's just one of the tests and then the overall full lab test. And so I had come across something that I was listening to on a podcast, as doctor said. It was super interesting. So I'd be curious about your feedback on it in regards to testing. He said, what people don't realize is that when they get back their test from their blood work, and it says they're within normal range, that
Mm-hmm.
normal range is representative of the people that have been tested. And 80%, I think it was like 80% of the people tested have a bunch of systems or disorders. And so if your test you get back and it says you're within normal range, it is essentially saying you're within normal range of sick people.
Yeah, that's a question we get all the time on lab work, and then we'll circle back and touch on the gut thing one more time. But uh, as far as labs, this is a really, really important point. Um, and for folks listening, this is where you got to challenge the narrative a little bit, okay? Because most people get labs done, from whoever, and they might get a call or email saying, "Hey, your labs are normal, everything looked good," and that's it. And like, okay, so like nothing bad, catastrophic, right? is showing up on these labs. Uh, but if you really kind of dive into, and this is where in the functional world we have a lot tighter window of normal. So we always say normal is not optimal,
That's right.
and we're certainly not trained that way. Uh, but for example, vitamin D we use all the time, or some of the hormones, but vitamin D we'll use today. If you look at the lab, the reference range or normal is 30 to 100 in most places. So 30 to 100, that is a massively wide range.
Yeah, it
And so
is.
how they come up with this normal is, and it's really based off the lab. So it's not just people, it's people that go to that lab. So you'll see different reports vary as far as their normal range on reports. So whether it be a lab core place or one of the local hospitals, it's pretty close, but there is some variation. But basically, they take that population and they kind of clip the five to 10% outliers, and then so you're kind of getting this 80 to 90% average, and that's the numbers that fall in for that lab value. And we get in this too a lot with the hormones because it includes people from 18 to 99. Like there's no age range for your testosterone level.
All right.
You're like, oh, I'm being compared to a 85-year-old guy or an 18-year-old guy or female for that matter for testosterone. So we try to tighten that up for like vitamin D. Like say, hey, we want your levels to be around 80, like 70, 65, 80, somewhere in there, because based off of what we know, that's a much better level than if you fall in that normal range of 30 to 100 at 32 and they tell you that, hey, everything's normal, then we want you to be better than normal. We want to find that little tighter range. So that's a really, really important point on these labs. And we'll go through the labs which we check, which are a lot more extensive than what people are usually bringing. And I will write down the numbers that I want them to be beside that, outside the range. And so it kind of starts to develop that, hey, we can be a little bit better than just average
Mm-hmm.
mentality to make things optimal to where they want to go. And then circling back for a second to the gut test, and this is such an important point, from a gut perspective. And Anthony's one of the healthiest guys that I've met. And he's driven, and just you were struggling with some of the gut stuff. And most of the time in our modern system, we look for structural issues. So like people will come, they've had a couple CT scans if they're dealing with a lot of belly issues, or maybe they've had a colonoscopy or a EGD, and some of them have had 3 or 4 done, and they're like, everything looks fine, just take this medicine. And so really the issues lie most of the time in a functional related issue. Kind of goes back to the migraine stuff. Like there's an imbalance, there's a sometimes some more chronic infections or a lack of stomach acid or an overgrowth or not enough good bacteria or an enzyme that's missing, or we see that all the time. People have had their gallbladder out, and sometimes we got to take them out from infection or whatever. But that gallbladder has a really important purpose. It's the reservoir for our bile and digestion. And I was talking to a friend just the other day. She had hers out, and I was like, "Well, do they tell you need some digestive support, enzymes?" Like no. It's like you should ask that in your follow up, and say, "Yeah, you don't need any of that stuff." But we'll see that on the testing. People struggle to digest fats after that
Yeah,
because they don't
absolutely.
have the bile salts there as that reservoir that pumps out that bile once you start to eat to digest those things, and so they really start to struggle with those kind of things. So it's more of a functional kind of solution, but we're looking at it from a structural thing, and so scans and everything aren't going to show that kind of problem.
Yeah. That's and that's what I love about again, all the testing and then the detail going into the testing. Now, some of the testing that we get into is going to tell us our hormone levels, right?
Mm-hmm.
So then we get into hormone levels, and then we get into conversations. Let's say that a man or a woman, they want to do weight loss, right? They're like, listen, I've heard, I know that you can do GLP-1s. I can go get GLP-1s here and there. And so I want weight loss. And one of the things that I appreciated about you most when I was asking you philosophy type questions, and even we got into conversations about GLP-1s, and your approach was very systematic and methodical. So instead of solving the problem, oh, yes, here's a GLP-1, you spoke about, well, what are you doing fundamentally first? And so, like, are you eating? Do you know what you're supposed to eat every day? Do you know, are you getting the proper amount of sleep? And that has to do with hormones as well. So whether it's GLP-1 or hormones, you were very in a methodical, practical approach that is not typically the approach of a pill. Or a needle, right? So yes, there are needles that go with those things, but your approach isn't needle first. It was approach first. Like, what are you doing currently? And then you asked me like a series of questions that are you doing at least these five to seven things first before we consider these things, right? What have you done on your end? Because what people tend to do when we talk about the pill mentality, or now it's become it was a pill first, and now that we're talking about like a needle mentality,
Yeah.
let's just call it the same thing, right? Is that we're looking to solve a problem, but we're not solving the problem. We're just solving the symptom, right?
Yeah, yeah. It goes back to the root cause of where our system is at.
Mm-hmm.
Is unless you've been living under a rock for the last few years, you know what a GOP is.
Mm-hmm.
They've become so popular, and they can be beneficial in many ways. So we use them a fair amount in our clinic, but I think you'll find that we do not tend to use massive doses. We tend to do this microdosing concept quite a bit, to be an adjunct to other things that you're talking about, because there is no magic shot, no magic pill, no magic. I would love for that to be the case too. I think we all would, but it becomes a little bit of a clickbait kind of situation when you see things on TV. Which, by the way, interestingly, U.S. is only one of 2 countries in the world that allow direct consumer marketing of drugs.
Yeah.
One of 2. I think New Zealand is the other one. No other countries allow the commercials you see on TV about Ozempic or the Sally Field and the osteoporosis meds. We always have a good laugh about that one.
Right.
Or whatever the case may be. So they see that, and that marketing is a very powerful thing. Like we say, Tylenol arthritis, is you see that everywhere. Like, well, what does that mean? Like, what's the difference? Like, oh, I have arthritis, I should take that. Well, like normal Tylenol is like 500 milligrams. Like Tylenol arthritis is 550 milligrams, so it's an
Mm,
extra 50 milligrams. But it's the marketing power of like, oh, I see that it's going to help me. I'm going to take this one thing, and all my problems are going to be solved. We're
right.
talking about, and it just doesn't work that way, and it gets tough. Like people come with, let's just use fatigue and kind of tie that into the hormone issue. Obviously, hormones are part of fatigue, but there's a handful of times that it doesn't have anything to do with testosterone or estrogen, or it's more of maybe something they're eating or the sleep or
Hmm.
something totally different. And so it takes a while on occasion to try to figure that out, and dive in. And that's where on the intake and those initial, you have to really spend time with people to figure those things out, and adjunct to those things, and like, hey, let's try this first and see how it responds, and then maybe we get to some shots or getting off of those things. So we will microdose people in the GLPs to help with like the insulin resistance and maybe a little bit of fat loss. But as we're getting better at other things, then we start to, okay, hey, can we start to get rid of this thing now to allow you to do it on your own? And
Yeah.
less is more.
Yeah. And so whether it's a GLP-1 approach for different things, and then you look at the hormone approach, what I've noticed is the hormone approach, or whether it's weight loss or energy or vitality or whatever it may be, is the hormone approach is as well from my experience and the people that I've talked to, is it's like sometimes it's like a 3 to 4 month lag, right? So you have to follow the doctor's advice and faith. You have to follow the appropriate protocols that the doctor is recommending, right? So that would be if you're going to do testosterone, if you're going to do estrogen, or if you're going to do any of the stuff, right? If you still keep on doing all the other things that you're trying to correct, like the bad eating out, the drink, maybe it's a lot of alcohol, maybe it's smoking weed, whatever it may be, you're still doing these things that are actually causing the things you're trying to fix to not work. And then you're going to wait 3 or 4 months, maybe, because I would argue that most people, at least in this culture and society, aren't willing to wait 3 to 4 months to get a result. That's what my experience says, and that's where you really have to have faith in the doc. You have to have a great rapport with them to trust them, because somebody like you has seen the results, and so you're like, stay with me, but you got to do
Yeah.
these protocols
Yeah.
and this protocol over here, right? It's not one or the other; it's both, but it's going to take 2, 3, 4, whatever that specific protocol is, 2, 3, 4 months in order to see a result. And that's where I see people lack vision for the life that they want to lead, which would create the healthy habits and discipline they need in order to maintain that life
Mhm.
for the rest of their life.
Yeah, that's a great point, Anthony. I think it's twofold. It definitely comes back to uh, people taking the initiative, because we live in that instant gratification world. There's no doubt about it. Everyone wants the quick fix, the timing of things. It's and there's very few things that fall into that category. But in all honesty, I think the other part of that is really the provider that they're seeing, um, having the time and the knowledge to share that with their client or patient, is like, hey, listen, we got some things to work on here, and we're gonna go through this protocol, and the first month you're not gonna feel like on the gut stuff. The first month we do is a lot of prep stuff. So like, hey, we have to get these three detox organs prepped and ready for this killing of bacteria or candida, because if we don't, this could build up. It could get completely worse. So this first month you're not going to feel anything,
Mm-hmm.
and you have to communicate that, and so they can expect those things, and it's going to be a few months, and once we do that, then we're going to check this, and we might need to tweak this later. But if you do too many things at one time, especially with the hormones, it gets a little tough. More so if people start to have some problems. You're like, okay, which one of those is maybe causing the issue? And as you think about how that plays downstream, it's much easier if you kind of take a slower and step-by-step approach. But if you don't share that with them, they expect to be better next week,
Right.
kind of thing. It's like, and on the microbiome, this is what I tell them. I was like we pull Anthony's stuff up here, we see all these things. I'm like, hey, it took you 40 years to get here. Okay. We're starting, so this is not going to be better in 2 weeks. Like this is, a several month journey and transition of changing this whole environment to benefit you, and then it's maintaining it after that so that the work doesn't stop. But to me, it's really sharing that as a provider, and it's hard to do that unless you have the time we talked about. You can't do that in 5 minutes and solve all the problems. And so that's where the follow-up stuff and explaining and going through those in detail, I at least I hope that it helps people understand that better.
Oh, absolutely. I know that we've enjoyed our time with you when we come in, because that's what when a husband and wife get to hear the information together, it helps for collaboration. Number one, at home, like what do we need to clean up at home? We can collaborate on sleep times. That was one of the things that when you and I first started talking, you're like, how are you doing with your sleep? I'm like, I'm doing great with my sleep. And then I went back to look at my sleep record because I've been wearing my Garmin for a long time, but I thought I felt good. I mean, you don't know how bad you feel till you feel good. Well, I thought I felt good.
Yeah.
I still think I felt good, but I feel excellent. Like it was the way I'll describe it. Like I felt fine, but it wasn't excellent, but I didn't know I didn't feel excellent. And so when you asked me about my sleep, and then I'm like, oh, actually, let me go back and check that. And I went to scroll back through my numbers on my Garmin and my sleep numbers. For the last probably 2 years, my watch continuously told me that I was 0% recovered and that I needed more sleep and not to work out. It's like, stop working out. You need to sleep. And I'm like, oh, this silly watch. It's just geared towards normal people. But the funny thing is about these things is that they learn your body, the technology does. And so when Ryan asked me that question, I'm like, I sleep great. And then when I looked at my thing and I was like, oh, I'm only getting like 4.5 or 5 hours of sleep a night. And so then I made it a priority to get 7 to 8 hours of sleep every single day. It took 3 weeks, 4 weeks, but then my biometrics caught up. So my sleep, my recovery, all of a sudden my watch started telling me you're recovered, or 80% recovered, or 90% recovered. The only time that it goes unrecovered, or it says that you had a crappy night's sleep or didn't sleep well, is with what? What do you think it is? Like if I did what? Alcohol every freaking time. Yeah, if I have any alcohol, dude, my sleep, it's funny to watch the grid, but it goes boom. Like it's my recovery just crashes.
Yeah, I mean, that was probably the most eye-opening thing when I did the Whoop. So I did Whoop for about 18 months, right around COVID. And then, it's more of a behavioral thing. I think that's where people struggle sometimes, is that when they see that poor score, they get frustrated. And then they sometimes let that consume them a little bit versus think about the behavior. So what those devices are really teaching you is a behavioral thing. It's a sleep hygiene, things to maximize HRV and time in those restorative stages. And it's like telling you like, hey, you have some habits you got to fix, but they focus on the score. Like, oh, I'm working out today. I don't care what my score was, and give you some advice on that. But at the end of the day, it's how you change your behavior to drive those things. And as we know, sleep is important for hormones and everything else. With poor sleep, like that's the thing that affects me the most. When I don't sleep well, I do not feel great. And I have hormones and all that stuff right where I want them, but it doesn't matter if I sleep poor. The hormones aren't going to save me. The testosterone's not going to save me that day because of the poor sleep.
Right.
I mean, I just feel awful.
Yeah, it's interesting too. Like last summer when I was running a lot during the summer, I was listening to all these health podcasts, and I was searching like a topic it was a GLP-1. Like I was just down a rabbit hole on learning everything I possibly could about all that stuff. And they asked all these docs, whether it was Peter Attia or all these other people that have commentary on it. And I will tell you, like 99% of the people that I listened to will say it was 10. So it was like 9 out of 10 people that I was listening to on a regular basis they were asking them their approach. So they're like, people come to you for weight loss. So they ask about the GLP-1, what's your approach? 9 out of 10 people, their very first answer was sleep.
Mm-hmm.
They said, I won't even consider putting them on a GLP-1 if they're not getting the correct amount of sleep every single night. Because if they don't do that, and there was like 3 things. It was like sleep, then it was like nutrition intake, and then it was like one more thing. I can't remember what it was.
Probably stress regulation.
Yeah, stress regulation. So it was like these 3, and they're like, once you get those done, then we'll talk about this. But again, the mentality of people is, no, I want this, and then the rest of the things will happen. Not the way it happens. But that sleep was a huge, and what people don't understand is that sleep has a huge impact on your hormones, on weight loss, on cortisol levels, on like all the things. And we are literally an exhausted, sleep deprived nation for sure.
Yeah. Yeah. And then that ties in the cortisol thing. We talk about that a lot. We ask questions about that. Nobody's stressed in this world right now, right? Except me. But your body, like when we talk about weight loss, or we talk about like some of our tick-borne patients with Lyme or whatever, that body will hold on to toxins and other things when it is in a stressful state or this fight or flight kind of response. And so unless we are able to improve that, stress level, whatever it may be, then we're going to have a really hard time getting to the weight loss, or like insulin resistant people are going to have a really hard time losing weight, in fixing those kind of problems. And of course, the cortisol ties into the sleep. If you're stressed, then your sleep sucks. And it's just kind of a vicious circle. And so that's why you have to really look at all of those things when somebody comes in to get them to where they want to go. Like one of the best analogies I've heard is you have your computer open, and like looking at mine right now, I have all these tabs open at the top of the screen. And we think that just deleting 1 or 2 of the tabs up there is going to make the whole computer work better. Where, we know that's not the case. And so looking at all those things and making those changes eventually gets people to where they want to be.
Yeah. Yeah. So at the before we got online today, I asked you, what are some of the things that you would love to share and talk about? And I think we've covered maybe about 3 of those things. So we've got about maybe 15 minutes left, maybe 15 or 20 minutes left. And I've got definitely one thing I want to end with, but in that time period, what are some other things that if you're sitting, this just reminded me, because I got monkey mind, is when I mentioned alcohol. It's sometimes people hear alcohol and they go, "Oh, I don't drink that much." Right? That's their thing. Well, I don't drink that much, like a beer or 2 a night, or maybe
social.
Yeah, social, no big deal. I am telling you, my sleep gets interrupted by 1 or 2 beers, and I do have, or drinks. I do have 1 or 2 beers, maybe one time a week, or every other week. And I'm telling you, it impacts whether it's 1 or 2 beers or 1 or 2 drinks. It does not matter. So if when we were talking about that, if you heard, well, I don't drink, and you're thinking 4, 5, 6, that's not what I'm talking about. It's the 1 or 2 that impacts the sleep. So wanted to share that.
Yeah, absolutely. And if you do measure, you'll see that objectively. And then sometimes that has a lot of power. So people, it will say, oh, I sleep 7 hours after I had a drink. But then if you look at the data, 30 minutes of that might be restorative or deep. The rest is light, which, is not, helpful at all. So yeah, when people say social, my next question is, how social are you? If you're social 5 nights a week, then
right.
Maybe it's a little bit more of a problem than we realize. But also the gut health, it's a gut crusher, hormone crusher, all those things. And, it becomes more of a social thing, of course. But I say, hey, people, you got to decide or commit to prioritize what's important. If you're really struggling with these things, then you got to make some changes, and I have a few drinks every now and then. I'm not saying never,
right.
But mine's pretty limited these days because I know how it'll affect. And then if on the nights, like on New Year's the other night, like I knew my sleep was going to be terrible. But, I just kind of accepted it for that night, and then the other, 95% of the time I know I'm going to be where I want to be on the sleep because of the lack of that.
Oh yeah, you should have seen. I haven't felt so tired through the holiday. I mean, being aware of it, but being so tired during the holiday season from Thanksgiving to Christmas, because Thanksgiving week we had a friend come into town. I went out and had 2 glasses of wine on a Tuesday. That's not normal. My score was like up here, and then my little next dot the next day, my sleep score was like down here. Not terrible, but not good. And so it was here. And then we had like 2 days later, we had Thanksgiving. So I had more drinks and heavy food and carbs and fats and stuff I'm not used
Right.
to. So then it dropped down further down here. And that was on a Thursday. Then my buddy, who I hadn't seen in a super long time, man, he's like a brother. So he's like, hey, let's come over and do tequila tasting. I'm like, okay. So I went over there and he's got very, very, very high end tequila. So we went over to do tequila tasting. And I had, I don't know, like, let's say 3 or 4, whatever, little, taste of tequila and all of it. And then it was like Tuesday and it was like gradual, and then Thanksgiving gradual, and then tequila tasting night, whoom, like it just freaking bottom just dropped out, right?
Like
And then
enough
it
is enough.
continued, not the drinking continued like that every week, but the heavier foods, the more alcohol from Thanksgiving to Christmas or New Year's, absolutely, like it made me tired through the holiday season.
Yeah, absolutely.
Brow. You're good. You're good. Um, All right, so we were getting ready to head into anything else you wanted to share.
Yeah.
That was front of mind. So I'll start back off there. All right,
Okay.
so as we're getting ready to wrap up here in the next 15 minutes or so, earlier, is there anything else that you're sitting at the coffee shop or hanging out with an old friend that you're like, man, if people just realized this, or if they just thought about this, what would another one or two of those be?
Yeah, let's see. We talked about being preventative and, um, kind of taking charge of your health. I think that's such an important one is if you don't feel right and you know something's wrong and they keep telling you everything's fine, find somebody else. Um, because most of the time they're right. And, maybe it's just they didn't check the right lab or they didn't go into the left details or there's many possibilities, but, keep digging, keep asking questions, keep being involved in that, and eventually you'll get to an answer. I tell you how many folks we've seen or have heard about that. Be an advocate for your own health. You have to be. And some of that, in all honesty, is the physicians or providers. Just being a little egotistical sometimes or shut off to other possibilities, and so that's why finding a provider that you mesh with is so important. uh, but I tell people I'm glad you came because you were right about this when you end up finding something or if they went somewhere else or whatever the case may be. So that that to me is kind of my mission, is to provide things for people that they either aren't aware of or don't have access to, whether it be specialty testing or adjunct cancer therapies or treatment for tick-borne illness or anything like that that can help people that's not just a medication and overall fix. And then the other thing I think I would say is kind of dispelling some of the bad myths in medicine about certain treatments or testing that we know is bad or not helpful, but some of the trumpets are so loud that it just takes a long time to change. And we're starting to see that with the hormone stuff in medicine with the recent removal of some of the black box warnings for um, hormone therapy and some of the bigger name people being on TV and the changes that are happening and women in particular with the Women's Health Initiative, which I think Peter Attia said it best when I listened to that, is that it was a good study with some really bad interpretation.
Mm-hmm.
And it really caused a lot of ladies, women to lose a quality of life, I think. And everybody became so fearful of hormones and therapy. I'll just share a quick example because it's a question we get a lot, whether it be estrogen with ladies or testosterone for guys. Will that, give me cancer, or will I have some of those other kind of things? And so we dive into some details, but at the end of the day, I say, these are things that our body produces naturally. So you've had estrogen in your body, and when you're pregnant, your levels are really, really high. And so, if it was addressed direct cause and effect, almost everybody would have breast cancer, or like guys will come in about prostate cancer and testosterone, which we know is not a cause and effect. Like, what do you think your testosterone is when you're 18 or 20? Like, why didn't you get prostate cancer then if it was
Right.
3 times what it is now? And so we go in and try to dispel some of these myths. So, heart disease stuff, or, that's kind of part of my mission, is educating and doing things like this, or lectures at different facilities and it just takes a long time to break those narratives in medicine and teach people, because it's just, it's viral, as they say these days. And so I want people to understand that and benefit from those things and have access. So those to me are probably the most important things of all, is to get out there and want people to know, if you're struggling with, traditional ways, like, look for a functional or integrative provider. And that looks different in many ways, right? It doesn't always have to be a physician or a nurse practitioner or a PA. Those are providers that can do a little bit more, as far as writing controlled substances. But it's a comprehensive approach. And that's what we're really trying to build here, is like, hey, you have a health coach or a nutrition coach, you got a, business coach. It's all those things together, for the greater good of the client. So, having access to that, or having an avenue is important for our clients to be able to, because I can't really fix people's nutrition as well as other people,
Right.
or, the chiropractors or PTs, I can't do that.
Right.
I have my niche and things, and I like to be aware of those and teach. But at the end of the day, it's referring to somebody that could help them more than you, that it works along with you. So that's why it's part of our core values, is the collaboration part. Like, hey, we want to work with your primary care physician. Like, we don't necessarily see ourselves as a replacement for your primary care. There's still important things that they do. And as you mentioned earlier, this is not a bad thing. This is not a slam on. But when you come with four labs and you're struggling, like, hey, we've got to dive deeper. And they may just not have that knowledge or skill set to do that, but we can help them with that. And they still need to do some of your screenings and some of your other relationship. You may have been with them for 25 years. That's great. Or the cardiology folks, or whatever the case may be. So that's important. And, sometimes you get a little backlash on that, and, you're thinking outside the box and pushing the narrative a little bit. But I think that's how people in medicine's going to grow, is never being satisfied and challenging that.
Yeah. And that leads me to my final thought or question or conversation, is that we talked about a collaborative approach. It's a collaborative approach with maybe somebody's primary care and also the patient and you, right? Sometimes it's you and the patient. Sometimes it's all three. And so that collaborative approach is what makes power, right? It's not confrontation, it's collaboration. And that's when it works really, really, really well. Now, the issue becomes, and I get asked this every single time, because people will ask me, because with Evie and I being nutrition coaches, so I'm teaching on nutrition stuff like food prep and macros and daily habits, like just different things like that. Simple, very, very, well, I would say they're simple, but not easy, right? Because we have to get rid of the bad habits. So simple things that are not easy. And so they'll ask me, they'll say, okay, so what is it? So what does he take insurance? Right. So they ask me that every single time. Does he take insurance? And I'll say, no, he does not take insurance. And they're like, oh, okay. And then like it leads me to another kind of caveat is I had a friend on Facebook and we were talking about medicine or something. And her daughter, she had made a post about her daughter, and her daughter was going to her primary care physician, and her primary care physician told her, so her daughter had bad acne. Her primary care physician told her that nutrition had nothing to do with her acne. So she quit seeing that primary care. She went into to like a skin doctor. The skin doctor actually said it's actually your nutrition, and so she cleaned up her nutrition. And I think it was in like a month, her skin went like extremely irritated to just like beautiful, like in like a month because the cycle went through and all the things.
Yeah.
And so people say, well, I can't afford to pay for this.
Yeah.
And she was saying, she's like, well, it'd be nice if they were covered, if this person or functional medicine doc or integrative or whoever were covered by insurance. And I said, my response was, well, not necessarily, because if they were, a lot of insurance dictates treatment. Maybe not all, but insurance can dictate treatment. And I don't want insurance dictating my treatment. I want an
Yeah.
unencumbered physician or nurse practitioner or anybody in that realm. I want them with their thought process and their professionality working with me, not based upon what the insurance is going to cover. Right? Because to
Yeah.
me, that's a bad idea, especially because insurance companies, not that they're bad, but they do make a very high profit margin, right? So let's just make sure that we understand that. And
Right.
so when people share, and again, when I'm sharing with people to go see Ryan, and they're like, does it come out of pocket? I'm like, no, and I don't want it to. And I explain them that process is they will say, well, that's probably pretty expensive. Then I always hop on them and I'm like, and again, I'll kind of go down like healthy foods expensive route. And I'll go, well, show me your last 90 days of bank statements.
Yeah.
Right. Because there's two things that are very important in this life: paying attention to your time, because time is the most valuable resource that we all have, that once it's spent, we can never get back. And it becomes more valuable with every passing second, and your money. And chances are, if you're not tracking one, you're not tracking the other. And so people talk to me about how expensive something is, or they can't afford it out of the pocket. But then if I, as a financial planner, put those goggles on and I look at their 90 days of what they've been spending, most of the time they're spending between $800 and $1,200 on things. And this isn't how much it would cost to go see a physician. I'm just saying that they're spending a lot more money on things they're not paying attention to. And so that's my
Yeah.
plight, like to get people to go see people that they have to pay out of pocket for. I'm like, that's fine. It's actually great. You want that is my plight for them.
Yeah. It's another one of those kind of stereotypes we don't probably talk about enough. And you just saying that kind of makes me think of the book "The Die with Zero" that a couple good
Hmm.
friends recommended last
Yeah.
year or two ago, and but it talked about how time you can't get that back, and what are your investments and your experiences, and versus if you save all this money and then you ill and you die, like what are you doing with that? Like, okay, give it to somebody else, or like how
Right.
are you investing your short time on this earth? And we've done a couple posts about the insurance question, or and it comes up a lot, and it's a valid question. And I tell people, like, think about what you get out of the insurance. Like, we've kind of just accepted as normal. I think the last time I looked, the average premium for a family was like $1,200 a month or something, somewhere in that ballpark, right?
Mhm.
So if you multiply that times 12 months, I mean, you're looking at like around 15,000, maybe $20,000 a year.
Yeah.
Now, most of us would say we do that in case something bad happens, right? Let's take people that have maybe some other chronic that are going for treatment regularly. Like, okay, that makes sense. Um, but if you take that, what are you getting for that $15,000 to $20,000 a year that you're paying for? At least the labs they're bringing, it's like 4 labs a year. Like, that's it. Like, are you getting nutritional training? Are you checking other things like preventative stuff? Like, so that's kind of just some of the discussion we have with them on the insurance thing. I agree. It may not be a good thing that if they were to cover those services in the future, because there is a lot of dictation, or they'll deny stuff like, no, we want you to try this first. Like, well, the patient and me don't think that's the best route for them. So or the prior auth kind of issue. So that's probably one of the biggest things that, as a provider, I think most providers will tell you that that's a pain in the side,
Hmm.
is the insurance denials and the dictations. And I mean, it's gotten to a point where there's definitely a lot of issues. Whereas, when you're investing in that, you get to make the decision. My job is to help guide you and give you the information. But at the end of the day, I give you those tests and I let you decide which ones you want to do and whatnot, and a guidance. It's not a dictatorship like you're going to do this test kind of thing.
Right.
It's us deciding together. And some people will use like their health savings accounts or their
Mhm.
FSA, and those or people use those all the time for membership, or invoice reimbursement, and your that tax free kind of stuff that you're investing in there. But I challenge them to really look at what they're doing from a healthcare. Like, they're wanting me to pay $1,200 a month. Like, I take zero medications. I don't have any health issues. Like, what am I going to pay you $1,200, $15,000 a year for?
Right.
Like, obviously, I do my own labs, but for that, I mean, if you really sit down and think about it for a minute, and then to your point, if you look at some of the other things you're prioritizing, um, it becomes a little bit more reasonable, to invest. And then there's so many of those free things that health that we talked about, the fasting, grounding, hydration, like those don't cost anything.
Right. It's when I look at the overall cost. So, like a long time ago, Evie and I, when I first started doing like entrepreneurship stuff, I don't even know how long ago it was now, like let's say 16, 17 years ago. And I was looking at health insurance at the time, and our health insurance for a family
Mm-hmm.
of five was going to be like $2,000 a month, like
Mm-hmm.
$24,000 for a freaking copay. Like, and you didn't always on any medications. And again, I think you already stated this with the
Yeah,
disclaimer of if somebody has a chronic issue and they have to have chronic care, stuff like that. That's an outlier.
sure.
That's
Yeah, I get
maybe
that. Yeah.
2%, right? That's 2%. So I don't want people to go, well, what if this, and they're bringing up a
Right.
2% issue, not a 98% issue. And so I just decided, I'm like, forget about it. I'll just pay the office. I'll pay the cash version of whatever they want me to pay at the door.
Mm-hmm.
So you might get a copay of, or free copays or whatever it is, 20 copay for $20 and free office visit. I'm going to pay, I'm going to make up a number, like $120 out of pocket. You pay a $700 a month premium or a $1,200 a month premium. I pay a $300 a month premium
Mm-hmm.
for more or less, it's Christian Medicare, but it's for like a catastrophic type policy with a high
Catastrophic stuff. Yeah.
deductible, right? So I'm leveraged. And so what I tell people is either you're going to pay the cost to somebody discipline you, or you're going to pay the cost of discipline, one or the
Yeah.
other. So people that don't yet think about it like that, they're paying the cost of somebody else disciplining them, taking money from their paycheck in order to provide a thing, because they can't yet or haven't thought about it yet with awareness to provide their own
Mm-hmm.
structure for savings. Does that make sense?
Yeah. Absolutely. It's a
Yeah.
mindset. Yeah, you're right.
Yeah. So if they develop that discipline, then they're paying that, which is just setting up an automatic structure. And that's a whole different conversation in my world, in order to accomplish that. But I implore people, like, seeing folks that you have to pay cash to is not a bad thing. It's become a thing that people don't do because they've never been taught to do something different. Right.
It's different. Exactly. This is the term I was going to use. It's different, and it's a little bit of fear kind of thing. And uh, once you explain it like you have, and they think about it a little differently, and it's the awareness. They're like, okay. And they start evaluating that a little bit deeper. And maybe I'm biased, but I don't think there's anything more important than our health.
Yeah.
And you can categorize that farther if you like. Like, some people will say my brain health is the most important thing, or if I lose my mind ever, that's nothing but just health in general. Like, there's a lot of things you can't be able to do. You may be planning, and if you have chronic disease and have a stroke or something and paralyzed, there's going to be, how many of those things you're going to be able to do after you're 50 or 60, or you never know what's going to happen. So, to me, that's the most important thing, outside of family and kids and prioritizing those things, obviously. But
Yeah.
man, we only have a short time on this in this world, so
Yeah. Let's
I'm
freaking
not
live
sure
it.
what else
Let's live it
I
abundantly. Let's live it with a ton of vitality. That's what I'm always talking to people. Like, quit living tired, quit living distracted, quit living like not feeling great, quit living with headaches, quit living with like sore muscles and tired and bad back. Like, quit living that way. There's things
Mhm.
that can be done, that whether you're working with a practitioner, you're working with a chiropractor, you're working with a massage therapist, you're working with a nutritionist, there's things that can be done to help you live a more vibrant life, right? If the ideal
Yeah.
is perfect as a perfect 100, and knowing that as we age, we're going to fall, we're going to be perfect 100 at that age, perfect 100 at the next age, perfect 100 at the next age. We may not ever get there because maybe we blew out our knee and we've got a knee replacement or something, but we still can to yearn and strive to living that more aware, abundant life. Does that make sense?
Absolutely,
Yeah,
absolutely,
yeah. So
love it.
yeah. So with that being said, man, I want to wrap us up, but I want people to know
Okay.
how to get a hold of you. So like what are the best channels to get a hold of you?
Yeah, so the website has all of our information on there. We're constantly making some tweaks as we add new things, new programs, new whatever. So that's the place I always got if we're talking. If I had some cards, I'd hand them out to everybody. But website has our phone number on there, email address. People can stop by and see us. The address is on there too. So any of those routes. Online, you can actually book a discovery call. So it's a 15-minute free call. We don't give any medical advice during that call, but it's just a general, like, what's your program? I want to learn more about it. Kind of some general questions about the structure and maybe a particular issue, like could we help, or like, but we're not going to go over lab results or give medical information in that setting. And then it's that base camp or the initial visit you talked about, and then kind of formulating a plan and figuring out what they need from there. But any of those modes of communication are perfectly fine.
Okay, good. So I'll drop the website into the show notes on this, and so we'll go from there. So, Ryan, I know that we talked about. I was excited about the opportunity to chat with you about this stuff like months and months and months ago. So I'm glad we finally got connect on this. This isn't
Yeah.
saying that Ryan and I don't get together in the future at some point in time on another one, because I do want to make health an emphasis in 2026 and being able to talk with people that are in health, that are healthy, right? That way we can have these conversations and provide some awareness, because once we have awareness, now we can take some action. And then you've got people like me and Ryan, they're going to hold you accountable to taking action so that you can feel awesome. So anyways, with that
That's
being
right.
said,
Spread the word.
yeah, spread the word. So with that being said, appreciate everybody's time. Thanks for listening today, and we'll see you again.
All right. Thanks, Anthony. Appreciate it.
Bet.